All right, welcome to the next section, 3.3, for the chapter on biological psychology. In this section, we're going to cover compare and contrast the techniques that scientists use to view and understand brain structures and functions. This will be a very short section. Let's go ahead and talk about lesions and what they provide. It says lesions provide a picture of what is missing. A lesion is just anything that's like a scar tissue or something from the around the brain matter. Right, so it says living humans, lesions are areas of the brain damage resulting from strokes, falls, automobile accidents, tumors, and other injuries. It could also be caused by surgical scars. So lesions can also be considered surgical scars. Created intentionally in animals, lesions allow scientists to observe any resulting loss in brain function. Right? One interesting case that shed a lot of light on lesions was this one with Phineas Gage. And his case was very important because, well, let me tell you the story, right? So he was a railroad construction foreman in the 1800s, and his accident is actually quite famous. An iron rod was accidentally driven through his skull, going through his left cheek and out the top of his head. He didn't die. He survived, and he had this very severe injury. But it didn't do much to him other than other than the scars, it changed his personality. So he had a very dramatic personality change afterwards. Before the accident, he was known to be very responsible, very hardworking. After the accident, he became very impulsive, very rude, and he had trouble sticking to plans. Um, so this sort of laid the foundation for looking at different parts of the brain, mapping out different parts of the brain, and connecting them to specific behaviors. So we get the connection of brain and behavior here. Gage's accident it showed that specific parts of the brain are involved with, in this case, personality and behavior. And his injury was to the frontal lobe, which we know it's important for decision making, but it's also important for self-control and social behavior. So the localization of the function, in his case, that provided this evidence that there's an idea for localization of function within the brain. So it just means that different parts of the brain control different aspects of behavior and mental processes. So in Gage's case, the injury helped scientists understand that the frontal lobes play a key role in personality and social conduct. This helps us understand the brain through brain injuries. So Gage's behavior after his injury helped doctors and scientists learn more about how brain injuries can affect people. Um, this also helped to, since understanding the causes, helped us with treatments, helped us with rehabilitation for those who had similar injuries, not similar to Gage's, but similar to others. And this is kind of important, and it's a foundation for a modern neuroscience. Phineas Gage, his case is considered one of the very first and most important in the study of biological psychology and neuroscience. Even though it was an accident, it actually wasn't a study, but it shed a lot of light. So what it showed was that you can study brain injuries, and that will provide valuable insights into how the brain works in humans. Right? You don't want to purposely cause brain injuries and lesions, but if someone does suffer from one, there's information there that can be gathered. Um, his story also humanizes the study of the brain. So it's not just about cells and chemicals anymore. It's not just this interconnectivity, this superhighway of information, um, but it shows how changes in the brain can deeply affect the person's life and their identity. So um, what it does is it helps us understand different parts of the brain helps us understand what they're responsible for, the functions they're responsible for, how they're related to personality and behavior. And in the case of Phineas Gage, which was a very important um, observation, right? It gave the link between brain structure and human behavior. And it laid out the groundwork for modern biological psychology as well. Let's talk about some tests that we do. So recording electrical activity in the brain. We use a tool called EEG, which is electroencephalography. It's a technique used to measure, record electrical activity of the brain. It's non-invasive, meaning we don't have to cut the person open or go internally. So it doesn't involve any kind of surgery. And it works by placing these electrodes, small sensors, on the scalp. And what we do is we measure the electrical activity that's being generated by the brain, and we're capturing it on the scalp, on the skin. And we detect brain waves this way. So the electrodes will pick up tiny electrical signals that are produced by the brain activity, and the signals, we refer to them as brain waves. They're at very specific frequencies, so we can isolate those frequencies. We can also record these signals, right? We can send them to a computer. We can run diagnostics on these waveforms. And we can kind of get an idea of what's happening in the brain. So there's 4 brain waves that we look at. It's alpha, beta, theta, and delta waves. Delta wave you might be familiar with, because that's the one that's most prominent when you're asleep. But alpha waves, these are the ones that you can measure when someone's awake, but they're very relaxed. The beta waves are associated with people who are active and they're thinking and they're concentrating, right? So they're awake, but they're engaged in something. Theta waves, these are common during light sleep or really deep relaxation, right? So I would say beta, active and highly concentrated, so you're thinking. Alpha, you're awake but relaxed. Theta, where you're awake but you're in deep relaxation. And then delta is when you're in a deep sleep. So we use EEGs for medical diagnosis. So we think of it like an ECG that measures the electrical activity of the heart, and we can understand pathologies of the heart with ECGs. EEGs, we look at these to try to diagnose things like epilepsy, sleep disorders, brain tumors, because we can tell when you're relaxed, when you're asleep, when you're awake, when you're concentrating. We can't tell too much, but it's what we have. And what it'll do, it'll help doctors see abnormal brain activity patterns that might indicate some condition. There's research in EEG, and it's used to study brain function, like how we process emotions, how we process information, how we learn. It's used often in sleep studies. Doctors will understand the stages of sleep, so what your brain is actually doing prior to, while it's asleep, and as you about to wake up. So these sensors that are used to collect the signals for the EEG, it's a brain-computer interface, unlike the Neuralink that Elon Musk is, his company's putting out, where it's invasive and the electrodes are physically connected to brain matter, brain tissue, cortex. In this case, it's just picking up electromagnetic signals that are being captured on the skin. We can actually use EEGs to control things too. So there are toys that can pick up, one or two of the signals, and you can focus enough to do it on demand, where you can maybe have that signal turn on a light or something in your house. So this is pretty cool. It's probably gotten a lot more advanced than that. That example was years ago. So There was an individual who was paralyzed, and they used an EEG to control the movement of his wheelchair. So it took some time, but he could move the wheelchair forward, backwards, and so forth. Just by thinking about it. And this is all non-invasive with the electrodes on the scalp, not invasively. So it's limited. The thing that Elon Musk has, the Neuralink, can do quite a bit more since it's got thousands and thousands of connections. You can also do real-time monitoring with the EEG to look at brain activity. It's again crucial for understanding brain conditions. And what it does, it also helps us learn more about how different parts of the brain work and how they interact during activities. Okay. And it's used in neuroscience, but it's also used in medicine. Let's look at advantages of EEG and disadvantages of EEG. So advantages are that it's non-invasive, right? It's not the Neuralink, it's not getting surgery, it's not taking any risk of, that are with the complications of surgery. It's safe, it's painless. The electrodes are basically they're placed on the scalp. There's no need for surgery or any kind of invasive cutting into the scalp. It's real-time monitoring, so the EEG records brain activity in real time. It's useful to see how the brain changes during activities. It's very cost-effective, right, compared to other brain imaging techniques or even an implant like the Neuralink. It's very affordable, right? So it's not because the procedure is very non-invasive and easy. You can also make it portable. There are portable EEGs that can be used and actually connected to something like the size of your phone, where you can read all the signals there. So we've got EEGs down packed. What else? We can get high temporal resolution from an EEG. It just means it can detect changes in brain activity very quickly. That's what temporal means. Like, so within milliseconds, you can actually detect the changes. So you can look at the response to any stimuli. The disadvantage is that it has low spatial resolution. Right? So good high temporal resolution, but low spatial resolution. So that just means that EEG isn't very good at pinpointing the exact location of the brain or that brain activity. It shows what's happening, but not precisely where it's happening in the brain. Another thing is that it's sensitive to movement. EEG recordings can be affected by someone just blinking, twitching, the facial muscles, and so it can make the data less accurate. As engineers, we try to filter out the frequencies for that signal muscle contraction, and we try to do a real good job of filtering those out so they don't show up as an EEG signal. The EEG signals are much lower in frequency, but they can still be affected by skeletal muscle, action potential. And the sensor is sitting right on top of the skin, and there's muscle underneath, so it can pick up a lot of other signals, artifacts. There's surface level information that the EEG measures and the activity of the outer layers of the brain. So it doesn't give much information about deeper brain structures, just mainly the outer structures. There is complexity to the interpretation. So you get a bunch of wavy lines that are produced by EEG. We call them EEG traces or EEG waves, which, we're talking about the alpha, the delta, the theta, and the beta waves. And sometimes it can be complex to interpret. It just requires someone who's trained and connecting the particular waveforms, amplitudes, all of that toward particular activities of the brain. And so someone who can actually distinguish the slight changes in these waveforms to some pathology. But along with the other artifacts from the muscles, it's prone to artifacts, meaning muscle contraction. If you're blinking your eye, anything, even if you move your hand or something, that generates artifacts on these sensors that are trying to capture only the frequencies that are being generated by the cortex. That's it. It's going to be a short lecture, just a couple of slides. fMRI, functional magnetic resonance imaging, a little more advanced, not a little more advanced, a lot more advanced. fMRI, functional magnetic resonance imaging, this is a special type of brain scan. It helps scientists and doctors see what parts of the brain are active when you're doing different things, so a lot better with spatial resolution. So if you're thinking about something, you're moving, or you're feeling emotions, you'll see different parts of the brain light up by location. What it does is it has a magnet, and it emits radio waves, just like an MRI. It uses this big magnet and radio waves to create detailed images of your brain. So it's similar to what a regular MRI does, if you understand how that works, but with a focus on brain activity. So it focuses on blood flow. So when a part of your brain is more active, it needs more oxygen, and what the fMRI does, it detects changes in blood flow because areas with more activity will have more blood and oxygen. The images that you get, they're pictures of your brain every few seconds, and these pictures show which areas of the brain light up when you're doing different tasks, basically by looking at the concentration of oxygen that it's demanding. So what an fMRI will show is which parts of the brain are involved in specific tasks. So if they ask you to speak, ask you to solve a problem, or just how you're feeling, if you're happy, you can actually map out spatially what part of the brain is lighting up, and by location where what's controlling that. It gives you real-time data, so real-time dynamic data. So in other words, as something's happening, as something's changing in the brain, you're actually seeing this happen in real time on the machine. The advantages of this is that it is non-invasive, just like the EEG. It doesn't require surgery or injections. You just kind of sit still in the scanner. You get detailed images. It provides this high-resolution image. It does show both structure and activity of the brain. It helps you map brain functions, so doctors will look at it to do studies on what part of the brain affects what. The disadvantage is that it's super expensive to operate. It's super expensive to buy one of these things, so cost is going to be a limiting factor. MRIs require you to be very, very still. If you think about one of those photos that you take at night when you're trying to capture the stars, and you have to leave the shutter open for a very long time, you can't move the camera or you're going to get like a lot of blurs. It's kind of like that, so the patient has to stay very, very still for quite a while. Depending on the strength of the magnet, the patient can be still for, and again, depending on what they're actually trying to measure. The more localized the area they're trying to image, the smaller the area, right, the faster you'll be in and out of there. But if the larger the area, the longer it'll take. So, in regular MRI, if you're trying to get a scan of just, let's say, your entire head, you're not doing functional, or an arm, or the chest, and you can be, depending on the strength of the magnet, you can be in the MRI scanner for an hour, 2 hours. The newer ones that are higher intensity, they can drop it down significantly to like about 20 minutes or so. But you will be spending some time inside the MRI. What else? Okay, advantages, disadvantages. I said it doesn't involve surgery. High spatial resolution. You get functional information. It's good for research and clinical applications. There's no radiation. This is not like X-ray. X-ray, which shoots ionized radiation into the body. This is just magnetic fields and radio frequencies that is being injected into the body. A disadvantage, again, it's just that it's very, very expensive. It's sensitive to movement, but so is all MRI is sensitive to movement. Understanding the interpretation of the fMRI images, it's complex, so it takes a lot of training. There's something that's more of a engineering psychology disadvantage, and that's claustrophobia. So patients, if you're claustrophobic, it's very hard to get a patient to actually go inside that tube and sit still. Right? So, and because we're looking at the function of the brain, we can't just like put someone out under anesthesia and stick them in there and image the brain. We want them to be alert and awake because they're going to be doing tasks and stuff. And that is it. Takeaways from this section. Lesion studies inform researchers about the impact of damage on different areas of the brain. Measures of electrical activity in the brain, such as electroencephalography, are used to assess brainwave patterns and activity. Functional magnetic resonance imaging, fMRI, measures blood flow in the brain during different activities, providing information about the activity of those brain areas. All right. Thank you for your time, and I will see you in the next section, maybe next two sections, of biological psychology.